Hi, and welcome to my channel. If you're a nurse looking to work remotely, you're in the right place. Hi, my name is Jazzy RN. I've worked remotely for over 9 years in utilization review, and the goal of my channel is to help nurses pivot from the bedside to remote work. And today it's all about LPNs. This first company is Cadence. They're hiring an LPN with a California license. Now, I always go straight to the qualifications. Even if you don't meet every single qualification, I still suggest you apply. This job is full time. We work weekdays from 8 a.m. to 5 p.m. or 9 a.m. to 6 p.m. Pacific time. You must be an LPN or LVN in the state where you currently reside. At least 5 years clinical experience as an LPN is required. Remote work readiness, high speed Wi Fi is required. An active California LVN license is required. Fluency in Spanish is preferred. Experience providing patient education and support to individuals managing chronic conditions is preferred. And fluency with AI assisted clinical tools such as Gemini, Open Evidence, or comparable platforms, and the ability to speak credibly with providers and patients about where AI supports care delivery and where human judgment remains non negotiable. The pay for this job is $26 to $31 per hour. Next company is Renologic. They're hiring a clinical nurse coordinator LPN. The job is full time. The pay is 50 to 60,000 per year. Small disclaimer on this job: you must live in a Pacific, Mountain, or Central time zone. Fully remote with minimal travel. Now, if you do get an interview with this job, I do suggest to ask about the travel arrangements. You must be an LPN or LVN and licensed with good standing with a compact state, plus willing to obtain licensure in other states as needed. At least 4 years LPN or LVN experience, plus clinical experience in oncology and infusions are required. Experience with care navigation, treatment support, and or complex case management is strongly preferred. Must live in either Pacific, Mountain, or Central time, and flex your work schedule to support members in every U.S. time zone, which means working some evening and weekend hours. Ability to speak, write, and communicate fluently in Spanish is strongly preferred. Utilization review and or care management preferred. Experience working 100% remote as a nurse is highly preferred. Ability and willingness to travel occasionally. They don't say where, which will include overnight stays for corporate gatherings, conferences, and health fairs. Ability to attend professionally engage in video meetings. Proficient technological skills, meaning you can effectively and efficiently use computers, peripheral equipment, and applications or systems, including Microsoft products. Now I'm going to stop there, and I want to add that make sure that you add platforms to your resume. That includes Microsoft Office, of course. If you know Epic, Cerner, Protouch, etc., the platforms you add to your resume will make your resume look more tech savvy. Quick commercial break. If you go to the description box below, you'll see a link that says free list of over 90 companies hiring remote nurses. You will see this screen. At the top of the screen, this is the links or navigation links to the Udemy course I created, Office Essentials, FAQs, resume tips, and interview questions. If you are viewing this on your cell phone, these links will be at the very bottom of the screen. But if you're viewing on your computer, you'll see them at the top of the screen and bottom. If you scroll down, you'll see a list of all these companies that hire nurses to work remotely. The majority of these companies hire nurses in the US to work for US companies, but some of these companies do hire nurses for the Philippines, Canada, Australia, and more. And some companies are actually international that hire nurses in different countries. If you scroll more towards the middle and go to the letter L, I do want to mention if you happen to use LinkedIn, you may see some jobs posted by Lensa, and I do suggest that you don't apply directly to the Lensa jobs. Look for the name of the company that's in a job posting and apply directly to the employer instead. I do remember someone mentioning on Reddit that they applied to Lensa for a nurse job and they were spam right afterwards. Just a FYI. Also, if you go more towards the bottom of the screen, it is a very long webpage. I have lots of jobs, lots of companies here. You'll see where you can go to do your own due diligence. So as you see here, I have Glassdoor. You can go there. You can go to Reddit, and I actually preferred the remote nurse job board and remote nursing. You don't have to actually have a Reddit account to view Reddit posts, but if you want to create your own post or respond to anyone's post, you need to create your own Reddit account, and it's also comparably Team Blind and Fishbowl. Alignment Health is hiring a utilization management pre-service remote California RN or LVN Pacific time schedule. This job is full-time and you can work anywhere in the US. The experience requirements include at least 3 years nursing experience in clinical setting, 1 year experience in experience with pre-service, at least 1 year experience managed care that includes Medicaid or Medicare, at least 1 year experience with the application of criteria, at least 1 year experience in medical setting working with IPAs, entering referrals or prior authorizations preferred, and at least 1 year experience with the application of clinical criteria, specifically Milliman Care Guidelines or MCG. You must have an active, valid, and unrestricted LVN or RN license in California. Immediately upon hire, you must be willing to obtain an LVN and RN licensure in Nevada, which is non-compact, Arizona, which is compact, North Carolina is compact, Texas is compact, which will be reimbursed by the company. And bonus points if you have a CPHQ or ABQA URP or Six Sigma certification, as well as medical terminology certificate. The next job with Alignment Health is an inpatient review nurse. Remote, must have a California LVN or RN license. This job is fully remote, full-time, and anywhere in the US. You must have at least 3 years of general case management skills, at least 2 years of experience utilizing Milliman Care Guidelines to justify inpatient versus observation length of stay, including review of diagnosis and length of stay, 2 consecutive years related experience in managed care setting as an inpatient case manager, experience with a senior population, education is successful completion of an LVN program, or preferred is associate's or bachelor's degree. You must have an active, valid, and unrestricted LVN or RN license in California, and immediately upon hire must be willing to obtain an LVN or RN licensure in Nevada, Arizona, North Carolina, Texas, which will be reimbursed by the company. Centene Corporation is hiring a clinical investigator 1. This is the special investigation unit. This job is full-time. This is a remote nationwide position, and the ideal candidate is either an LPN or RN with coding experience. They prefer you to have experience in an insurance company, SIU, or fraud department. Strong fit if you have experience reviewing medical records for fraud investigations, and physician office experience preferred, especially in a specialist practice. Background and record review and documentation quality is highly valued, and documentation improvement specialist experience is also a strong match. Education and experience, they require an associate's degree related field or equivalent experience preferred, 2+ years related clinical experience in the field of obtained license required, provider education preferred. Licenses and certification include coding certification from an accredited organization, RN, LPC, LPN, LCSW, LHH, LMHC, PTOT, or ST or related license is required, and the pay for this job starts at $56,000 per year to $101,000 per year.